Hello, it's Dr. Gay from First Look MRI, and this is a patient who has an injury to their fifth finger. They jammed it about 2 months ago playing football, and they can't straighten it all the way. In this view, we see there's some fluid over here. Something is definitely wrong with the proximal interphalangeal joint. Now, if we put up the sagittal view, we see that the finger is not straight. So we have a flexion contracture here, the PIP joint of the fifth digit. We see the flexor tendon looks pretty good. And now the extensor tendon here, the middle part of the extensor tendon over this PIP joint, you have something called the central slip. And they thought that maybe this could be torn. And it looks like this is part of the central slip coming up. And we lose it. So on this one, it looks like it may be partially torn or completely torn. Now we'll put up a sagittal view from a T2 weighted sequence here. This is a T2 fat sat. We'll come over here to find that. And there it is. Okay, so here is, let me zoom this on up. The extensor tendon come over here. It looks like it is intact, and the other one you could not see it, but it's thick here. Right here it does get a little bit thin, so it's maybe partially torn and attenuated, but it's not a complete rupture of the central slip. It comes over and attaches right here in the base, and we see this fluid. Now, one thing we do notice here, there's marrow edema on both sides of the joint, big joint diffusion, and maybe this is partially torn and attenuated but not ruptured, but the flexor tendon looks like it's intact, but it's pulled away from the proximal phalanx here. So this looks like it may be a pulley injury. So the A2 pulley is right about here, and it keeps the flexor tendon hugging close to the bone. You really can't see it as a distinct structure, but maybe there's gray tissue here, maybe part of it. But if it just hugs the bone well, you know that pulley must be intact. But here, the flexor tendon is far away, so this is the A3 pulley is in this region. And it looks like the A3 pulley must be torn because the flexor tendon has drifted so far away. So, and they said they had a joint diffusion, marrow edema, and possible injury of the central slip here, but not ruptured. And it looks like the A3 pulley, again, that makes the flexor tendon hug the bone here. It loops around like a lasso. Looks like that is probably torn, allowing this to drift away, and that's why there's fluid there in that space. And that's it. Thank you very much.